really a very powerful message. So I hope you take some opportunity to really let it sink in. Let it, listen to the statistics that you're going to hear today. Listen to some of the aspects of personal stories that you might hear reference to. If you have any questions, I know you're encouraging them. Right?
Absolutely.
And absolutely, too, if you want to talk to anyone privately after the presentation's over, I know that Ivy and Katie would be more than happy to do so. Okay? All right. Very good.
Yeah. Okay. So if I could ask everyone in the room to close their eyes for just a second for me. I want to ask all of you, while you have your eyes closed, to just think of some things that you love, things that you really care about. So maybe, your mom, your dad, brother, sister, maybe it's a cat or dog, maybe it's Breaking Bad or football, baseball, basketball. But just go ahead in your head, start to make a list of things that you really love and that you really care about. So it's pretty easy, right? It's easy to come up with those things that are really important to you. But I want to ask all of you, while you're thinking about the most important things in your life, how many of you would put yourself on that list? All right, so you can go ahead, open your eyes, come on back to us. I'll turn it over to you.
All right. I'm going to start by talking about recovery. And I'd like to start by taking a moment to break this word down, because each letter has a different meaning. R is for realizing that you are worth it. E is for experiencing true happiness. C is for caring about yourself. O is for overcoming your own demons. V is for validating your own worth. The second E stands for eating without regret. The second R is for relapse. It's inevitable, and that's okay. Now, before I finish up with the why, I'd like to take a moment to discuss why relapse is a part of recovery. Dr. Karen Bello has given some very wise words about this subject. They say it takes, on average, 7 tries to quit smoking. If someone fails on their 6th attempt, it doesn't mean they're a failure. It just means they haven't hit that 7th mark yet. Recovery from eating disorders is like that. Missing the mark once doesn't make you a failure. Slipping repeatedly doesn't mean you're hopeless. It just means you haven't tried enough times yet. And personally, that was one of the hardest things for me to get over. I'm definitely an all-or-nothing thinker. It's black or white, no gray areas. And my recovery was not exempt from this. If I had a slip, I immediately wrote it off as a failure, and then boom, that slip turned into a full-blown relapse. My treatment team has been very diligent to remind me that relapse is a part of recovery. It sucks, but it is something I have come to accept. And now, the why of recovery. Why is yearning to live? It's the will to take back your life from the eating disorder. Now, I'd like to add a disclaimer. These 8 components of recovery are very different for everyone, simply because recovery is individual. There is no schedule of when you will be able to experience all of these components. But what I can say is that the longer you stick with recovery, the happier you will be. Now we're going to be transitioning into Nita's PowerPoint. Now, I know a lot of you are psychology majors, so it won't be as hard for you to understand. But this PowerPoint is very clinical, and the terminology comes straight from the DSM.
Yeah, sure. So what are eating disorders? I think it's really important to start by talking about what they actually are. So eating disorders are diseases that involve extreme attitudes surrounding weight, food, and size. And they include some that you've probably heard of, and actually a few that you probably haven't. So anorexia, bulimia, binge eating disorder, and the new category that they just added in the new diagnostic statistical manual for psychology, other specified feeding and eating disorders. So they are very serious disorders. They have both emotional and physical consequences for both men and women.
Now, anorexia nervosa is characterized primarily by self-starvation and excessive weight loss. The symptoms include restriction, which would be inadequate food intake, leading to a weight that is clearly too low. There's a disturbance in the experience of the body weight or shape, distorted body image, intense fear of weight gain, and obsession with weight and persistent behavior to prevent the weight gain. And there's the inability to appreciate the severity of the situation. They do not see themselves as sick. The health consequences of anorexia. Because it is a cycle of body is denied of the essential nutrients it needs, which leads to the body not being able to function properly. Thus, the body is forced to slow down all of its processes to conserve energy, resulting in serious medical consequences. These would include like an abnormally slow heart rate and low blood pressure, a reduction of bone density. Osteoporosis is quite common in anorexia patients. Severe dehydration, because it comes to the point where they'll even restrict fluids sometimes. And muscle loss, fainting, fatigue due to the inadequate nutrients. And one of the first things to go when your body starts to slow down is the reproduction of your hair and skin cells. So hair loss is very common, and so is dry skin.
Bulimia, by contrast, is characterized by this cycle of binge eating, and then after the episode of binging, and feelings of intense guilt, intense shame, that usually lead to a type of purging. And I know the purging that is typically thought of with bulimia involves inducing vomiting. It can also include excessive exercise, also taking diuretics, taking laxatives, anything really to try to rid the body of the amount of food that the person has just consumed. There's also this component of feeling really out of control during these binge episodes. People that binge usually say, I wasn't able to stop. I could not stop myself. I just kept going until finally I hit a point where, the shame and the guilt became too much. There's also extreme concern, as with most eating disorders, with shape or weight. And most people, I think the last one is really important to point out, most people are of a normal weight when they're struggling with bulimia. So I know that there's a lot of stigma surrounding this idea that people look sick, they don't look sick. But in the same way that people who aren't struggling with an eating disorder have all different types and shapes of bodies, people who are struggling do as well. So there's no one body type. People with bulimia tend to not look in the way that we would expect someone to look sick with an eating disorder.
And something I'd like to add to that is that people with anorexia can also use the compensatory behaviors. But the difference with anorexia and bulimia is the binging.
So health consequences of bulimia, also pretty serious. They lead to at least electrolyte imbalances because, again, even though you've consumed all this food, you are ridding your body of it, so you're not getting the same nutrients as you would if you actually allowed yourself to digest it. There's a potential for gastric rupture, as well as esophageal rupture, which literally means that, because you are engaging in this repeated cycle of vomiting, your intestinal tract cannot handle it anymore. Tooth decay, your teeth are not intended to have repeated contact with your stomach acid, it wears away at your enamel. And chronic irregular bowel movements as a result of using laxative, and I'm going to go as far as to say also diuretics to an extreme, can lead to a lot of issues, a lot of gastrointestinal issues in your body.
And then binge eating disorder. This was not recognized by the previous DSM. It was under the EDNOS category, but in the new DSM-5, it is considered its own disorder. Now, binge eating is a type of eating disorder characterized by recurrent binge eating without the regular use of purging behaviors to counteract the binge eating. Indications of somebody that may be struggling with binge eating disorder is that the binge eating is out of control, such as eating even when they're not hungry, eating to the point of discomfort, and eating alone because of the shame of the behavior. And there's feelings of strong shame or guilt regarding their eating behaviors.
Something I actually got asked this a couple days ago, so just in case anyone's not sure, binge eating is characterized, essentially it's an excessive amount of consumption of food in a very short amount of time. So really like non-stop eating for a short period, the shorter than normal period, like eating a day's worth of food in the span of a lot, in one sitting.
And then the health consequences of binge eating disorder would include a higher risk of obesity, high blood pressure, high cholesterol levels, heart disease, type 2 diabetes, gallbladder disease, and musculoskeletal problems.
And finally, this is, like I said, the new category that was just added, the other specified feeding or eating disorders. So essentially what these are is this is a large blanket term to cover a lot of subtypes of eating disorders that don't fit under the typical criteria of the other three we just mentioned. So there's atypical anorexia nervosa, which is the criteria for anorexia is met, but the weight criteria might not be met. And this can be for a lot of reasons. There are people that never hit a point that are underweight that are still very, 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 very sick. Or other symptoms might not manifest themselves because everyone's body is different, so everyone's body reacts in a different way to being depleted of nutrients. Same with the subvessel bulimia. It tends to be less frequent occurrences or perhaps less episodes of this binge and purge cycle. But of course, anytime that anyone's engaging in that behavior at all, that's an abnormal relationship with food, so it's a cause for concern. Subspecial binge eating disorder, again, occurs at a lower frequency. There's purging disorder, which is the purging without binge eating that Ivy mentioned earlier. Oftentimes this can also go hand in hand with anorexia, in that they'll have anorexia with subtype purging disorder, which means that the person is not consuming excessive amounts, they are not going overboard, but they are still having that reaction with any food, that they want to get rid of it, they want to get it out of their bodies in any way possible. And finally, night eating syndrome, which is brand new, which is excessive nighttime food consumption. So the person still has an unhealthy relationship with food, they're still struggling with food, but it tends to manifest itself more at night. So these disorders, while they aren't recognized as like the large overarching categories, I do want to emphasize that they are still just as serious, that even if these behaviors are occurring at a lower frequency, even if the person is not drastically underweight, even if the person doesn't, again, look sick, that doesn't mean that the issues are there and that it isn't just as risky.
And then there's tons of reasons why people develop eating disorders, and this just goes through the cycle of what we just talked about. Eating disorders can arise from a combination of established genetic, behavioral, psychological, interpersonal, biological, and social conditions. That's a lot of terminology. But basically what that means is there's definitely a genetic component. There's the behaviors that we just told you about to look for, and then there's the psychological well-being. Typically, eating disorders are a way of coping with your emotions that you're uncomfortable dealing with. Interpersonal relationships, that's like my sorority sisters, how I interact with them, how I interact with my family, my best friends, and then biological would be go along with the genetics, and then the social conditions. Social conditions are the bigger picture of the interpersonal relationship. That's society as a whole and where you fit in that.
So, as we're talking about eating disorder, I do want to talk a little about my experience and what went into mine. This was a really hard part of the talk to write. I found it really hard to even describe what goes on in the mindset of someone with an eating disorder, because to me it's very clear, but to put it in terms that someone who isn't struggling with it can understand is really difficult, because when you actually sit down to write it, it's this very paradoxical thing where it makes sense in my head, but then when I go to speak about it, I'm like, this sounds ridiculous. So the way that I have come up with to describe it is, you know that inner critic voice that you have that may look back at a picture of you from middle school and go, oh my god, what was I wearing, what was I doing? It's like that little voice that kind of, critiques little things about you that isn't necessarily always harmful. It's there, it's in the back of your head, it kind of keeps you in check. It says, maybe you should do a little better on that exam next time, maybe you should step up and take on another responsibility. It's like that voice, except much louder, much more constant, and completely brutal. For me, it kind of took on this characteristic of just drowning out any form of rational voice, any form of rational counter thought. It would say, no, that's wrong. You aren't worth it. You're still, all these just negative thoughts cycling constantly. I actually just recently watched a TED Talk by a therapist who did brain scans of people who have eating disorders, and a big thing that she talked about was that the part of the brain that is responsible for that, that internal monologue is it's constant, it's noise, and it's excessive, and it's very distracting in a way that it interferes with your ability to interact with other people, it interferes with your ability to concentrate and focus and relate to the world, because in your head there's this constant preoccupation. And while it does manifest itself in terms of food, back in the mindset of someone with an eating disorder, it isn't necessarily constantly about food. In fact, for me, usually those thoughts about food were almost a relief from everything else that would be going on in my head. It was a distraction and a way to deal with things when I couldn't deal with what was actually going on in the real world. I know too that people have asked me, since we've gone over the health consequences of eating disorders, why? Why would you do that? You know how dangerous it is, you know how bad it can be for you, why would you engage in these behaviors? And the truth is that when you're in that mindset, when you're very stuck in that, part of you can't appreciate it. Part of you is like, I know it's dangerous, but whatever, I don't think it's actually gonna get that bad. And part of you doesn't really care. It's like, so if it gets that bad, I have this voice in my head telling me that I deserve it anyway, so why would I care? Why would it bother me? So what I really want to emphasize is that, while there are a whole variety of factors that contribute to an eating disorder, that's because they are about much more than food. They do run much deeper than that. They run into deep issues of self-esteem, of genetic components of your actual brain makeup. And a lot of times it is a coping mechanism in the same way that a lot of other negative things can appear as coping mechanisms. Some people turn to drugs, alcohol, etc. Some people turn to food as a way to cope. Some people turn to positive things, they turn to music and writing. But for someone with an eating disorder, it really is a way to cope with things. It really is a distraction and a way to kind of distance yourself from the world and from the struggles that you might be experiencing. So factors that contribute to an eating disorder, again, big four: psychological, biological, interpersonal, and social.
The psychological factors would include a low self-esteem. It's very, very common that people with an eating disorder have a really significantly low self-esteem. There's the feelings of inadequacy or lack of control in life. I know personally that was why I engaged in my eating disorder so much. It was the one thing that I could control when everything else was falling apart around me. And then there's the emotional part. People will often suffer from depression, anxiety, anger, or loneliness. And that's because of engaging with the eating disorder. When you say you're restricted, your brain's not going to be able to have the other emotions because it doesn't have the energy. The anxiety comes from the food aspect oftentimes, and the anger comes from you're angry at the world, you're angry at yourself, and then you're lonely because you're isolating.
Something I want to build on that a little bit. Eating disorders do thrive in isolated environments. I mean, a lot of times for me it was this idea of like, I shouldn't have friends because they're getting in the way, because I can't do the behaviors that I want to do if there's someone that's around that cares about me, that wants me to take care of myself. So it's a very, very intensely isolating illness. Biological factors. This actually is really important to me right now because my father actually just got diagnosed with an eating disorder about 6 months ago, and I actually asked him if I could, share a little bit of his story. Eating disorders do have a tendency to run in families, and for a long time, like my treatment team, various therapists, psychologists, etc., would say, "Are you really the only one in your family?" And I was like, I think so. I think it's just me. It's not. Actually, genetic effects account for 88% of the liability for developing anorexia, and at least half, but usually closer to about 83% of the liability for developing bulimia. So if someone in your family has it, you are exponentially more likely to have an eating disorder as well. And there are genetic components. As I mentioned, there's research about the brain taking place, that chemicals in the brain are actually getting thrown off in the mindset of someone who has an eating disorder. So whereas someone who doesn't have an eating disorder might eat something and think, this is good, this is healthy, this is good for me, I'm enjoying company of other people while I'm doing it, it's a positive interaction. For someone who has an eating disorder, a lot of times food will trigger intense fear responses, intense anxiety, extreme thought distortion, and it's showing up in 3D MRI scans. They can see that parts of the brain that are lighting up in people who have an eating disorder are not the same parts of the brain that light up in people who do not.
And then the interpersonal factors. As I explained earlier, that is your close circle of family and friends. So the way this works is the interpersonal factors would include a troubled family and personal relationships. If someone is not living in a healthy situation with their family, or they do not have a great support system, they're going to be at a higher risk of dealing with an eating disorder, and it's going to be more difficult for them to recover. There's going to be difficulty expressing emotions and feelings, as I mentioned before, because often the eating disorder is how they cope with the emotions. A history of being teased or ridiculed based on size or weight. There are people that struggle that have not had that, but I know I personally, growing up, was constantly picked on for my image. And then the history of physical or sexual abuse.
And finally, societal factors, and this is a really important slide to me because I think that there's a misunderstanding as to this idea that society is the cause of eating disorders, and if we could fix everything with society, eating disorders would go away. That's not true, but there are a lot of things I wish we could fix. Certainly there's this overemphasis that on thinness, on looking your best, on physical appearance in general that does drive girls and men as well to be obsessive about their weight, about their appearance, about the way that they look. Our cultural norms, obviously, they seem to value people a lot based on their appearance instead of any inner qualities that they might have. So this is my personal viewpoint on this, but I think that society, while it's not a cause of eating disorders, I think that it certainly exacerbates the issue. If there's someone that already has these tendencies, that already has these issues in the back of their head where they are insecure about their weight, their size, and they're struggling with a lot of other things, society kind of comes along and says, that's okay. Like that's what we encourage. So in a lot of ways, it can really intensify those behaviors and those distorted thoughts. And invalidate them in a very unhealthy way.
I would agree with that. I wouldn't say that society is the cause, but it is definitely a trigger. The warning signs of anorexia nervosa, we did talk about this before, but just to reiterate, there's dramatic weight loss, a preoccupation with weight, food, calorograms, and dieting. But what I'd like to talk about with the preoccupation, it is so much more than just counting calories. It's limiting yourself to a certain food group. It's saying, I can only have this amount of that for the entire day. There's the refusal to eat certain foods, progressing to restrictions against whole categories of food. Like some people will cut out carbs and things like that, and which can also lead to depression. The consistent excuses to avoid mealtimes or situations involving food. Look out for that. If you have a friend that every time you invite them to lunch or dinner, they constantly have an excuse. I know Candace, when she saw that I was relapsing last time, she would not take my excuses. I would say, well, no, I have to work on a paper. Or no, I really need to go to work when I wasn't even scheduled, and she would drag me out and take me to dinner. But, and then there's the withdrawal from usual friends and activities. Like we said earlier, the isolation is a big component.
Bulimia, again, it's slightly different, but a lot of the same patterns. Things you can look out for include these like frequent and excessive trips to the bathroom after meals, excessive exercise and rigid exercise regimen. You know, well, I can't do anything right now because I have to go exercise or I have to go to the bathroom immediately. Discoloration and staining of the teeth. Like I said, your body is not intended to endure stomach acid in your mouth. So your teeth will actually get stained and the enamel will start to wear away. Withdrawal from usual friends and activities. Again, that component of isolation is really prevalent in eating disorders. People tend to push other people away because obviously they're inhibiting them from using those behaviors. And there's also, there's a name for it, and I can't remember what it is, but they're calluses on the back of your knuckles that is caused from excessive vomiting, from self-inducing vomiting. So those are all warning signs you can look out for.
And then the warning signs of binge eating disorder. They will be very secretive about eating or binge episodes. There will be repeated episodes of dieting or attempts at weight loss. Uncomfortable fullness after binge eating episodes, so don't constantly be saying how full they are. Large amounts of food may be missing from the pantry or found in the trash, and then larger than normal amounts of their money, their budget, will be spent on food.
And finally, of the other specified feeding or eating disorders, a lot of the warning signs are very similar, but they're not as consistent as found in the clinical criteria for the other disorders. Again, increased isolation, depression, irritability, compulsive obsessive exercising. But something I do want to call attention to is that in all of these warning signs, as you'll notice, very few of them are visual. Very few of them have to do with the way the person actually looks. It's much more about the way the person is interacting with their environment, the way the person is interacting with food. And I think that that's an incredibly important thing to talk about because, again, I think we have this idea of they don't look sick, so they might not be sick. They might be very sick, and the warning signs you're looking for are not physical. So you want to actually make sure that the things you're looking for in someone that you think might be struggling extends far beyond just what they look like.
All right, and now to go back to Nita's theme, which this year is I had no idea, I'd like to talk about the misunderstandings of eating disorders, as Katie started to a moment ago. Typically when someone mentions the word eating disorder, we all have an image that pops into our head, right? What many people misunderstand is that more often than not, eating disorders are an invisible illness. So many people suffer in silence, and no one addresses it because they don't look sick. And I was a victim of this stigma. No one knew about the hell I was going through until I told them. And when I did, I was shrugged off by the uneducated. The only reason I was able to get the level of care that I needed was because I found a treatment team who advocated for my health even when I didn't want to anymore. I was in denial of ever being sick because I didn't feel that I looked sick. But I am extremely thankful to my treatment team for getting me into a higher level of care when they did, because otherwise I may not be here today. I encourage any one of you, if you or someone you know is struggling, please do not wait until you think you look sick or they think they look sick, because by then it may be too late. Eating disorders are mental illnesses with physical consequences, and the longer you're engaging in eating behaviors, the worse the damage will be and the harder it will be to overcome. And this slide basically just says everything that I did. They are treatable. They are very, very serious, even if it is the OSFED. But they are treatable if caught in time. one of them that I am very adamant about is that eating disorders are not a fad or a phase. Don't write it off as just another diet. Because anorexia nervosa has the highest mortality rate among any other psychological illness.
I'm going to build a little bit on the fad phase too, because I know in high school and college campuses, dieting is rampant. It's everywhere. I'm sure that half the people in this room have either done it at some point or are currently doing it. Dieting is everywhere. Diet culture is everywhere. Eating disorders are the next step of that, in that they are much more serious and much more deadly than just a diet. So it's not a fad, it's not a phase. If you know someone that's struggling, this is not a diet that once they lose X amount of pounds, they're going to snap out of it. It's much more complicated than that, and it does need to be treated as such. So prevalence of eating disorders, they are extremely prevalent in society. As I said, as many as 20 million females and 10 million males will struggle with an eating disorder just in the United States. So we're not even talking globally. In the United States.
And that's just the ones that have sought help, the ones that have been diagnosed.
Also important to point out, yes, this is just as far as we know, as far as people who actually have gotten the help that they needed. Again, 20 million females and 10 million males. Important to mention as well, 10 million males is a lot. I know that this tends to be considered a more feminine disease. That's a huge number. That's a huge number. Out of 30 million people, like, that's, you know, if we have 30 million people with an eating disorder, 1 million of them are going to be, or 10 million of them are going to be males. It does also have a greater prevalence in society than autism, Alzheimer's, schizophrenia, but research for them tends to be inadequate because they tend to not be treated as seriously as these other disorders.
It's less than $1 per person, the funding. I mean, it did gain 10 cents from last year. Last year it was only 83 cents, but it's still only 93 cents per person struggling, which is nowhere near enough to send anyone to treatment. Now, eating disorders among males. A lot of this is very clinical. I'm not going to go through all of it, but one of the things I would like to point out is that it does happen to males, and the body image thing is something I find really important. Body image comes from more than a desire to be thin. It can also come from, I don't feel masculine enough, I don't feel muscular enough, I don't feel like I can compare well enough to my peers. Even now, magazines are saying that curves are in. There is no such thing as a body type being a fad, for one. You have a body type and that's just the way it is. So then all girls are frustrated because some of us are naturally thin, so then there's the issue with, well, now I'm not curvy, so nobody's going to love me. Their body image is so much more than just being thin.
And also, I want to build on the eating disorders among males too, because like I said, my father has one, and he was diagnosed 6 months ago, but it started when he was in his 20s, which was a solid 30 years ago, back before the dialogue about eating disorders was open at all, and much less for men. For him, it was like, well, this is what I have to do. You know, and he thought that he had uncovered some kind of secret almost, like, oh, I can, you know, eat as much as I want and get away with this, and it'll be fine because I just use this behavior, and it'll be great. And it's just now, as this research is coming out, that it's extremely prevalent in the male community that he's realizing, oh my gosh, I've been doing this for years and never known that this was actually an issue, or that this was actually something that could cause me serious health consequences. And again, I want to build off of what you said as well, that for men, a lot of times it can be more about building up the body types that they want and, you know, creating muscle mass, creating strength, looking masculine, looking strong, rather than what we typically assume an eating disorder is, which is like this desire to be thin. Eating disorders and diversity, they don't discriminate. That was one of the themes at a talk that I went to back last year. Eating disorders truly do not discriminate. They affect people of all socioeconomic statuses, age, race, gender, sexuality, everything. There is not any group that is free from the effects of eating disorders. Again, there are a lot of statistics on this. I have those available if anyone wants to approach me and actually learn the numbers for those, but suffice to say that they are extremely common across all races, all classes, all sexes, all genders, etc.
And then the co-occurring disorders with eating disorders. It is not uncommon for someone who is struggling with an eating disorder to also be struggling with some other psychological disorder. One of the most common would be self-harm. And I know that also the eating disorder behaviors can be considered self-harm. I know that was personally what my therapist said. She said that my eating disorder was my way of getting back at myself. There is a higher risk of individuals with an eating disorder to abuse drugs and alcohol, depression, and other mood disorders are quite common. There is an elevated risk for obsessive compulsive disorder, the sense of control, and post-traumatic stress disorder. As we mentioned earlier, abuse is common, and history of abuse is common in eating disorder patients, and if they have not properly dealt with that abuse, then they have a higher risk of developing post-traumatic stress disorder.
I also want to talk a little bit about PTSD and the sense of trauma in general, because I think that we tend to imagine trauma as a very extreme, something catastrophic happens to you, but trauma can be caused by many different things, and things that you wouldn't typically consider traumatic can be traumatic for certain individuals. So as far as abuse is concerned, as far as those kind of struggles feeding into an eating disorder are concerned, anything that's caused you extreme distress can feed into symptoms of an eating disorder. Okay, finally, mortality. This is the roughest slide to go through. A review of nearly 50 years of research confirms that anorexia has the highest mortality rate of any psychiatric disorder ever, period. The end. I think the current statistic is about 1 in 10. So about 1 in 10 person that is not including people who don't get diagnosed, who don't get the help they need, but people who are diagnosed with an eating disorder, about 1 in 10 will die from anorexia. Risk of death from suicide or medical complications is also markedly increased in individuals with an eating disorder, obviously because you are putting your body through such intense strain all the time that your risk of dying from the behaviors that you are using is significant. Again, suicide as well, because other mental illnesses tend to go hand in hand with eating disorders. Eating disorders individuals with eating disorder not otherwise specified, which has been rebranded as the disorders we went to, OSFED, are sometimes viewed as less severe. They still stand the same risks as everyone else. They are still using the same behaviors. You can die at any point in time from using any one of these behaviors, so they still have the same health consequences. And this is the shocking thing to read for me personally. For females between 15 to 24 years old who suffer from anorexia, the mortality rate associated with this illness is 12 times higher than the death rate of all other causes of death. So these disorders are real, they are serious, and they have very real fatal consequences if left untreated.
And here are some do's and don'ts on how to help a loved one or a friend. I think it's very important. This is something I'm very passionate about because I've dealt with so much stigma and so many of the don'ts were given to me. But I think it's very important that you learn as much as you can about eating disorders. And I think it's great that all of you are doing a great step towards that today by coming to this talk. It's important to be honest and vocal about your concerns without placing blame or guilt or shame. And you need to be caring but be firm. Don't make rules or promises with that. I can remember someone saying that they promised, I can't remember exactly what they promised, but they tried to bribe me into going to dinner with them. And that just does not help because that is adding the guilt, shame, and blame. Be a good role model. Please practice what you preach. It is so hard when somebody is constantly trying to get you to not engage in your behaviors, to not judge what you see in the mirror. When you're all doing that to yourselves, when you pick up a magazine, when you try out a fad diet, be sure to compliment your loved one's inner qualities. Don't tell them how thin they look. Don't compliment their efforts at losing weight. Talk to them about how caring they are, how intelligent they are, how passionate they are, how creative they are. And tell a trusted adult, if applicable, if you don't know what to do, then go to somebody on campus, whether it be public safety, the nurse, the campus counselor, the resident's life, because it's very important that this person seeks help.
And so because it leads right into the next part of our presentation. If you know someone who is struggling, like I said, we have the do's and don'ts up here. Another don't, please don't think that you have to be their entire support system. Please do not think that it is on you to save this person. When I went into treatment, the first thing they did was assign a minimum of 4 people, licensed medical professionals, to help me. So I had therapist, psychiatrist, nutritionist, and doctor to monitor physical issues. These disorders are real, they are all-encompassing, and they are very deadly. It's not something you can take on alone. If you know someone that is struggling, it's really, really hard not to do the don'ts. So please don't try to do it alone. Please don't try to be a support system alone. If you are struggling because you know someone who is struggling with an eating disorder and it is hard for you to cope with the issues that they're having, you are just as right in talking to someone, you are just as right in reaching out to someone, and it's just as important for you to get the help and support that you need as well. So please never feel like you have to be the entire support system for someone who is struggling. You don't. It's a dangerous position to put yourself in. It's a dangerous position to put the other person in. Make sure you're taking care of yourself first and foremost, the person who is struggling after that, because ultimately you are the one that needs to make the decisions that are healthiest for you. So speaking of treatment, perfect. So there are a couple stages, including intervention, professional support, and then ultimately recovery is possible. But it is a multi-step process, and it's very complicated.
Seeking treatment. Because as we've said, eating disorders are very complex, and with that, the treatment is as well. You need a team. Personally, my team is not as developed as recommended. I see a psychiatrist, a nutritionist, and a therapist. I have an established doctor, but we don't really keep in contact. It is very important to have a team because there's so many different aspects of what the eating disorder affects. So it is important to meet with a medical professional for the initial assessment, to make sure your labs are okay, to make sure your heart is okay, that everything is holding up. Review different treatment modalities and approaches. Determine the level of care needed. Interview providers to find the best fit for the individual's needs. I know sometimes it can be hard to find a treatment provider that you actually like and get along with. And that's very important as well, because if you don't trust your treatment provider, whether that be your nutritionist, your psychiatrist, your therapist, doctor, you're not going to be motivated to recover. And then make sure you're communicating with your insurance to ensure your coverage. This is very step-by-step.
So levels of care, there are several. They range from like the most intensive, the most round-the-clock care, to the least intensive. So they include residential, inpatient, partial, and intensive outpatient. Can we speak of residential?
We're going to break it down in the next slides.
Yeah, that's fine. Yeah. So residential treatment essentially means the patient is medically stable, but they require round-the-clock care. So as far as their physical body, they're not in intense crisis. They don't need hospitalization because there's, their blood work is normal enough. Their body is safe enough to go into a facility like this, but it is still round-the-clock care. So I've actually personally been to a residential place before. I kind of want to demystify it a little bit because I know that people kind of wonder, like, well, what is this facility that you go into? And they just like, what do you do? So essentially, like I said, it's round-the-clock care that involves a lot of groups, a lot of, obviously, meal times. They're very structured to try to get people back on a normal schedule of eating. And there are people on call all the time. So anytime that you might be struggling, there's someone there that's available. There's a lot of groups that teach you about everything, really. Everything from like ways to deal with certain situations in life to ways to restructure your own thought patterns, ways to think about yourself in a more positive way, that kind of thing.
And then inpatient treatment. Both times I happened to be in treatment, I was an inpatient. The patient is medically unstable, as determined by whether it be the blood work or their vital signs or complications due to coexisting medical problems such as diabetes. That is basically the only difference between residential and inpatient is the medical stability. Inpatient is a hospital setting, but you still get the round-the-clock care, you get the doctors, and therapy when applicable.
Also, inpatient can be caused by if the person is, even if they are medically stable, they are not stable enough to keep themselves safe. So we talked about self-harm and how self-harm goes into eating disorders. If you are not able to keep yourself safe enough, that's a reason to go in inpatient, because residential can't provide that same kind of isolated, really safe environment. Partial hospitalization, so this is, I was going to say step down, but that's not the correct word. It's a little bit like, almost like going to a school in a way, except it's like school for learning how to reintegrate into society and how to take care of yourself again. So you go all day long, and then you spend the evening at home, you sleep in your own bed. Usually you'll have a meal or so at home, but then the rest of your time is very structured. So a reason for going into this is because either inpatient is not what you need at the time, outpatient is not what you need at the time, you need this intermediate level of care where you're still able to exist in your home environment, but you need intense treatment every day. I don't know if you want to say any more about that.
Otherwise, it can be a step-down program. I know when I left inpatient the second time, they had wanted me to do a partial program just to reintegrate outpatient treatment and outpatient treatment. Intensive outpatient is a bit higher than the outpatient treatment. It won't be every day, but it will be more than once a week. The patient is doing a lot better with the behaviors and is able to be trusted to be left alone for, let's say, 4 days a week. And then outpatient treatment is currently what I do. I see a therapist and a dietitian once a week, just to make sure everything is still going okay. Is there anything to add? And then NITA does have some stories of hope and recovery forums and everything like that. We can put this back up for anybody who would like it afterwards.
So what does NITA do? Because we're here representing them. So NITA essentially advocates for individuals and families with eating disorders. So it serves as a catalyst for prevention as well as cures. And I think it's really important to mention that while they work with people with eating disorders, they work with people who are in the environment of someone who has an eating disorder as well. Because like I said, these disorders affect everybody around the person struggling. So they are also there to advocate for friends, so family, other people who might be, in this environment where they're not sure how to help somebody. NITA has resources available for that as well. And NITA, in case I didn't say this, it stands for National Eating Disorders Association.
And NITA does have information on a referral helpline. Again, this is something we can put back up at the end if anybody would like us to. But they do offer different treatment referrals, and everything is confidential.
There's also the NITA Navigator program. Do you want to talk about that?
This is something I have used. NITA Navigators are free. I think that's one of the best benefits. And if it's something you're not necessarily sure you're struggling with an eating disorder, but you do have some concerns, definitely sign up for someone. These are volunteers who have either dealt with it personally themselves and recovered, or had a family member that did it, or a trained professional. And they volunteer their time, and they'll email you at least once a week, and you can just talk about what's going on in your life, and they can help you decide what level of treatment you need to seek.
Yeah, they also literally navigate the system for you because it can be very confusing and conflicting to figure out what do I need, what kind of help do I need, where do I go to get it. They have all the resources in the world to be able to help you figure out what it is that you need, and they're able to kind of guide you through that process. And of course, eventually there are additional NITA support references. I have a bunch of brochures. They're in the back, so if you want to take them, it has lists of how to help people with eating disorder, what an eating disorder is, all the different helplines and other things that you can call if you have concerns about yourself or about someone that you care about. So please, by all means, take the resources.
And then this was National Eating Disorder Awareness Week, and you've all been involved. So with that, I'd like to conclude my part of the story, and by saying recovery has been anything but rainbows and ponies, but I can say that it has been so much better than continuing my life in the throes of an eating disorder. To be completely honest, I still struggle to face the mirror every morning, and there are days that picking up the fork just doesn't seem like an option. During these times, I am reminded that I'm not doing this alone. I have utilized the free NITA Navigator service, and one of my biggest supporters happens to be Katie, the girl I booked for Teal last year for our Eating Disorder Awareness Week. And I have a fantastic therapist and dietitian who remind me that recovery is my only option. And thanks to recovery, I have the support of a wonderful man who not only wants what's best for my health, but doesn't question me when I fall apart. I also was blessed with an amazing little sister in my sorority who did not disown me when I had to take a 2-month leave of absence, but rather called me nearly every day and welcomed me back with warm and open arms. And with this, I'd like to leave you with a quote from philosopher Jean-Paul Sartre. Freedom is what you do with what's been done to you. I used to find it so easy to question the universe about the cards I had been dealt, but the questioning never led to anything. One day I realized that I am not alone in my struggles, and so I decided to advocate for them.
To conclude with my part as well, mine is also a story of hope because I'm here today, I'm here talking to you. I do want to talk a little bit about you for a second, because I'd imagine that even if, I don't know what it was that brought you here today, maybe you know someone that's struggling, or you have concerns about yourself, or maybe you just have no idea what eating disorders are, in which case thank you for coming and learning. But these issues, these underlying causes, are things that everyone struggles with at some point in their time, in their life. And I think that it's really important to say that, each of you is here for a reason. I really appreciate you coming and learning about eating disorders. If you do have any concerns, or if you are struggling yourself with any kind of issue, it's really important for you to know that if you do not deserve that. You do not deserve less than other people. If you think for any reason that you deserve anything less than the people sitting on either side of you, you are wrong. You really are wrong about that, because there's no one on this earth that's allowed to tell you that you are less of a person for any reason, no matter what it is. So it's really important that you know, too, that if you're struggling, if something's hard for you, you don't deserve to go through that. You deserve to reach out. You deserve to get help. And recovery really is possible from anything and from everything. It is possible to get to a healthy